All right, everyone, so we're going to review how to check a blood sugar, which is very important for EMT basics to know how to do because it's kind of on your workup of people who have altered mental status, potential diabetes, potential stroke. So there's a lot of patients that you'll be checking blood sugars on. So there's a number of components. There's like a little glucometer bag in your jump bag. There's multiple components. There's the glucometer itself, and every glucometer where you work is different, so make sure you're familiar with that. But these are the ones we use in the EMT class. All glucometers come with strips, and strips have an expiration date. So every time you check in on your shift, you always check the expiration date. And by golly, these expire in 2 days, so we're still in tape, the 31st, 2020. So that's pretty good. You want alcohol pads to clean off the finger. These are needle sticks, and so you want to minimize risk of infection. So alcohol pads, Band-Aids for afterwards, and then lancets. Every glucometer has kind of different amounts of lancets. Not amounts, but different like styles of lancet. Some you just pull the thing straight off. Some you have to twist to prime. Just know where you work. And then of course gauze. So first thing we're gonna do is we're gonna wear gloves, or PPE. So I'm gonna check my own blood sugar, so I'm not gonna wear PPE, but if I were in a testing situation, hint, hint, I would verbalize I'm gonna wear PPE, or you would wear it if you're actually demonstrating it. You're going to first wipe off the area. So I like to do the lateral fingers. It hurts less. I find the way that makes patients, when it hurts them the most, is when you amp it up so much. Like, oh, I'm going to stick you. It might hurt. We're going to count down very slowly, and that just gets them like anxious. So do it quick on the side of the finger. Doesn't hurt that much. So I'm wearing PPE. I'm going to clean the side of my finger. If it's like super dirty, really make sure it's clean. Let it air dry, don't pat it off. Get your gauze, so I'm gonna open this gauze, those sterile gauze. And then the first thing you wanna do once you get your lancet on the side of the finger is get all your ducks in a row. So I'm gonna get a strip out and prime my glucometer, and it should give me a little beep and then show me on the glucometer, let me make sure, there's a little, it says, give me a drop of blood. All right, on the glucometer. So I cleaned it off. I'm going to prick the side of my finger, 1, 2, 3. Ow, that really hurt. So that will go into a sharps container. I'm gonna wipe away the first drop of blood. And then if you don't get any blood, which it's really hard to see on me because I'm not getting any blood, you can kind of milk around and get a good drop. All right, so that's a plethora of blood for a glucometer stick, all right? And then I'm gonna approach the bottom of the blood, the strip, and it will tell us what my blood sugar is. My blood sugar is 120, which is not ideal, but I did eat recently, so that's within normal limits, so I don't need oral glucose. So I can wipe away the remaining blood I have and then put a nice Band-Aid on it. So some pearls for checking blood sugars. I've learned that you do not check an automatic blood pressure cuff in the same arm at the same time you are doing a blood sugar stick, because at high pressure from the BP cuff will squirt out blood from your stick, and I have done that to myself twice. So don't be like me, be smart, and don't do it at the same time. Other pearls, like I mentioned, don't belabor the stick. It's really not that bad. The more you amp it up, the worse the patients will feel about it. These go in sharps containers. That's another pearl. And lastly, you can do this on other parts of the body. So frequently, if you go to a baby and you do a blood sugar stick, or a kid, you can use the heel as long as you can express blood after you do the prick. You should be fine. You just need to get a single drop and load up from the bottom of the strip.